Are you someone who's suffering from unwanted fat in your thighs? They're causing these ugly bulges. Your clothes, your jeans don't look good on you. You've tried everything, diet and exercise, but they just don't go away. Well, here is a solution that is safe, effective, and gives you a great result. And that might be liposuction. So, thighs are an area wherein fat accumulation can be very problematic compared to other areas. If it's in the outer thigh, for example, it forms these ugly bulges, what are known as saddlebags. They're called saddlebags because horses used to have bags on their sides that looks like this. And this looks very ugly if you're using any kind of form-fitting clothing, such as jeans or pants. So there, even if the rest of your body is in shape, there's this weird bulge which looks very, very awkward. As far as the inner thigh, heavy fat over there is a big problem because the thighs rub against each other. And this is a big problem when walking or running. So what this does is, even though you're trying to get rid of that fat by doing exercise, you're not able to because your thighs are rubbing together. And this can cause irritation, it can cause friction, it can cause fungal infections. So these are some of the reasons why stubborn fat in the thighs is a big problem compared to other areas. Now, what are the solutions for this? You see so many exercises that are targeted at the thigh specifically. You do this exercise, the fat in your thighs will go away. Unfortunately, exercise doesn't work like that. Targeting a particular area doesn't target the fat in that area, it targets the muscles in that area. So if you do a lot of squats to get rid of the fat in your thighs, that won't happen. Your thighs will become a little bit bigger because the muscles in your thighs develop more. Exercise does not target fat specifically. Exercise targets fat everywhere in the body. So it's all about caloric deficit, how much you take in and how much you burn. When you burn more than you take in, your fat goes down. And where does the fat go down? Some areas fat does go down earlier. That depends on the concept of stubborn fat. So what is stubborn fat? Now fat cells have receptors to hormones. Hormones can be of two types, fat burning hormones such as adrenaline and fat storing hormones such as insulin. Now different fats have different level of this receptors. Some fats have more receptors to fat burning hormones. That is the fat that will go away first. Some fat has more receptors to fat storing hormones. That is what is called stubborn fat, and that is the fat that will go away last. So whenever someone starts exercising for some time, there is some fat that goes away quickly. It varies from person to person. But there is also some fat that just doesn't go away. That can go away, but it will be the last fat in your body to go away. So this is why getting rid of that stubborn fat requires a high level of diet and exercise, which is something that a lot of people don't have time for. An added complication to this is a lot of the stubborn fat, particularly in women, develops after multiple pregnancies. During pregnancy, this fat gets stored and this fat is particularly hormone resistant and it is hard to get rid of. So does that mean that exercises won't work? No, it can work. Diet and exercise can work, as I said. If you maintain calorie deficit and you burn more than you eat and you do cardio, then that fat can go away, but like I said, it will be the last fat to go away. There is no exercise that will particularly target that fat. If I do arm exercise, the fat here won't go away, and if I do thigh exercise, the fat there doesn't go away. Exercises target the muscle groups in that area. And that brings us to liposuction. Liposuction is a body shaping surgery that works extremely well for this kind of localized areas of stubborn fat. In liposuction, what we do is we make a few small holes, and through those holes we suck out the fat that is present just below the skin. So this works particularly well when there are certain pockets of stubborn fat and you're not looking to remove fat everywhere in the body. You can't remove all the fat in your body with liposuction. It works best for targeted areas of fat removal like this. Now, what is unique about us at the Venkat Center is that we do this surgery under local anesthesia. What that means is we only give anesthesia to the area that we are operating. We don't make you unconscious. We do it this way because one, it makes the surgery very, very safe. You're avoiding all the risks of general anesthesia. You're also avoiding the complications of liposuction, which is causing internal damage. That is very rare, but in local anesthesia it doesn't happen because the muscle layer underlying the fat is not anesthetized. Two, we can make you stand up in the middle of the surgery. See how it's looking, make you lie down, do some more. So this helps us to give a better result as well, because things look one way when you're lying down and another way when you're standing up. Three, we're able to do the dressing in a standing up position. So this really helps us to squeeze the skin and give good skin contraction. And speaking about skin contraction, in liposuction, we're only removing fat. We're not removing any skin. So obviously it's going to be a little bit of extra skin which has to shrink, it has to tighten. For this to happen, we use a special device called body tight. You can see the image here. This is a radio frequency energy assisted skin tightening device. What this does is, through those same small holes at the liposuction, this device is introduced and uses heat energy on the inside of the skin to stimulate the skin to shrink and contract. So how does the surgery work? You pick a date, you come get it and go home the same day. There's no admission or anything. When you go home, there's a bandage around your leg. You need to come back the next day to get the bandage changed. You need to come for 2 days to get the bandage changed. 3 days after the procedure, you can go back to work. Now, with local anesthesia, there is one limitation, which is that you cannot do too much in one area. Inner thigh and outer thigh has to be 2 separate sessions. But in the thighs, we recommend, whether local or general anesthesia, not to do the whole thigh in one day. Because if you do the entire thigh circumferentially, that affects lymphatics and you can have swelling and other complications of your feet. So we always recommend staging the inner thigh and outer thigh separately. Here are some results of thigh liposuction that you can see over here. So I find thigh liposuction a very gratifying procedure to do. The patients are always very happy. Outer thigh liposuction creates a big impact wherein their body immediately looks better, clothes look better on them. Inner thigh liposuction creates a big impact because the patients are more free in walking and running, and then actually they are able to put in more effort at the gym because their thighs aren't rubbing together, and this helps them lose weight that way. I hope this video was helpful to you. Do like, share and subscribe. If you have any questions, let us know. Thank you. Have a great day.